Welcome to Veterans Forum, a program by veterans, about veterans, and for veterans and your families. I'm your co-host, Bob West, with Ray Chattery and Jerry Devlin. Our goal is to provide important information on legislation, benefits, support, and activities for you and your family by interviewing leaders in our community. Jerry, who do we have with us today?
Tonight, Bob, we're very, very fortunate to have Nancy Qualey Giannopoulos, who's been with the VA for 26 years and presently is Associate Director for Operations of VA Maryland Healthcare System. And Nancy has been all around the VA circuit. She's leads the day-to-day operations of environmental management, facilities and engineering, information resource management, information security, on and on and on. And probably no one would be more useful to give the veterans and other people who watch this on Bowie Cable an idea what VA Maryland is doing within the healthcare system. She is, of course, a native Pennsylvanian, which we won't hold against her. She's a graduate of Penn State University, which you Terrapins out there won't hold against her. And she has a graduate degree from the University of Pittsburgh in Western Pennsylvania. We're really, really very happy to have Nancy Qualey Giannopoulos with us tonight, Bob.
Welcome, Nancy.
Thank you for having me.
Tell us a little bit about the VA Maryland location and the services that are provided.
Great, great. Well, let me start out and say, to make it simpler, we call it the VAMX. That's so much easier to get out than saying the VA Maryland Healthcare System. And we call it that because we do really service the state of Maryland. And so we have three primary locations. We have our downtown location, which is down on Green Street. We have our location out in Perry Point, which is in Perryville, Maryland. And we have on the Loch Raven Boulevard, we have a campus there. We have 5 outpatient clinics throughout the state.
Well, that pretty much covers a good portion of Maryland. And tell us about the services that are provided.
Well, we have a very, very comprehensive healthcare system. We have both inpatient and outpatient services. And so at Baltimore is primarily where all of our medicine and surgical care is, both inpatient and outpatient. We do all of our primary care there, so people come in for outpatient care, routine visits. All of our outpatient specialty care is also done there as well. That would be medicine and surgery type clinics. Then out at our Perry Point campus, we have some medicine there, but we're very much dedicated there to a lot of our mental health services. We have a very, very comprehensive mental health program, and we provide treatment for substance abuse, post-traumatic stress disorder, many other mental health related problems, and you can receive many, many services there, both for veterans and their families. And then at our Loch Raven campus, we have a nursing home, which now we're changing the name, we're calling it the CLC, Community Living Center, trying to get away from giving the impression that only people can go into what we consider to be long-term care, that you have to be elderly or in a nursing home, because we have many, many returning veterans who need some long-term care as they are recovering from ailments and injuries. And so we're changing the name to Community Living Residence. We have 120 beds there, and then we also dedicate a portion of our beds there to hospice care and then also to rehabilitation.
But it's important for our veterans to know that they have to get registered in the system.
Absolutely, absolutely. And it is wonderful to be able to talk to you tonight about considering VA care if you have not already used our services. And yes, you can enroll with us 3 ways. You can stop by any one of our outpatient clinics or any of the sites that I've mentioned. You can go to our website, which we are showing on the screen for you to register, or you can call, and our 800 number for the Enrollment Center is also on the screen as well.
Well, that's great. So tell us more about what's happening now in the VA.
Well, you know, we're really, really trying to get out there and promote our services. And so one of the things we're trying to do is we're starting a new campaign called Televet. And what we've decided is that some of the best way to get people to try using the VA is to find other veterans who have used the services and encourage them to go out, find veterans, and talk to them about enrolling. And so we have a large campaign that too is on our website. We're doing a flyer and poster promotion, and we're really trying to outreach to folks like yourself, people here in Bowie, to try to get people to go out, find veterans, and encourage them to learn more about our health care.
One question, I know that the Disabled American Veterans, by the way, Jerry is the current state commander for the DAV here. So no, he'll be coming up and visiting you. We run a hospital service coordinator there, which sends vehicles out and brings patients to the center. So is there a number that the patients can call, or the person want help to call in order to get in on this?
Yes, if you go to our website and you go to the voluntary service tab, the number is located there where you can get rides. And that is one thing that we really ought to talk about, and that is one of the very unique things about the VA healthcare system, is that there is a tremendous transportation system which is really out of partnerships with the veteran service organizations. And as you have mentioned, service organizations have donated vans, and not only do they donate vans, but they get the people who are willing to volunteer to drive to help outreach to veterans who cannot or do not have the ability to drive or have their own transportation system, and that we will go out through this mechanism and help people get to clinic appointments. And that is a very, very unique thing about VA healthcare, something you don't find in the private sector.
Now, another question is that the C-Box, we now have 5.
Right.
And then there'll be one opening up in Fort Meade, you say 2012. Now, where are the 5 locations of the C-Box, and what does C-Box actually stand for, so our audience knows?
Right. C-Box stands for Community-Based Outpatient Clinic. This is something that probably over a decade ago we started to build small clinics out in the neighborhoods, because one of the things that's really important to the VA is to find ways to increase the access to veterans. And so we believe that if we put small clinics out in the neighborhoods, it makes it easier for people to get to them. Now, you can get a lot of things done. This is your basic kind of primary care where you can see for routine medical outpatient care. And over time, we've really tried to improve them. We have some specialty care in those clinics, podiatry, sometimes eye care, and most importantly, we've added mental health to all of those clinics. And this has become something that we feel is very important, that we provide psychological support as well as medical support out in our clinics. And so you can visit one of our clinics in Glen Burnie, Cambridge, Pocomoke, Loch Raven. Up on our Loch Raven campus, we have put a clinic there. And who have I forgotten? Fort Meade, Fort Howard, and Fort Howard. We still have a clinic over at Fort Howard. And we're very excited. We are going to build a clinic with the Department of Defense over at Fort Meade. And groundbreaking is probably going to start November 1st. And we hope to have that clinic built sometime in the early part of 2012. This is something that has been an initiative that's been going on back to President Bush, where he wanted the VA and the Department of Defense to start collaborating together to try to serve veterans and start serving them while they're still on active duty. So we are going to collate our clinic there right next to Kimbrough. And so we're really excited about being closer in your neighborhood. We hope that many of the people here in Bowie will come over to that clinic when we get it open.
About how many people are currently served in VA Maryland?
We have about 54,000 people who have enrolled with us and that we serve actively.
And as far as the picking the locations of the clinics, how is that determined? Do you have an idea?
Well, what we have done is looked at the population in the state, and we've taken areas that we have concentrated, where we feel there's large concentration numbers of veterans. And we have a goal that people don't have to drive more than 30 miles or 30 minutes.
What do you have in Western Maryland? I was trying to put all these centers together.
Well, when you start getting into Western Maryland, you probably
Martinsburg,
start moving into the Martinsburg
right,
catchment
right.
area.
That's what I was wondering, is that you gave the locations.
Right.
It seemed sort of
Right.
Eastern Shore oriented.
Right. And they have a clinic in Frederick.
Yeah, of course,
Yeah.
yes.
Is there a reason why didn't you put a CBOC in Prince George's County? Or is it because of Washington VA?
Yes, we're getting very close to the Washington line, the Washington catchment area. And I think we chose Fort Detrick, Fort Meade because that's where the base is.
Right.
And so when we were going to, because you know we have our clinic in Glen Burnie, which is, I think people in Prince George can consider that to be near their homes.
Yeah, most of us here would rather go there than
Yeah.
we would go to, say, Brockville, which is
Yeah.
a
Yeah.
horror to
Yeah.
drive to
Yeah.
from here.
Yeah.
Something to take back with you, Nancy, is that we discussed earlier, Prince George's County has the largest population of veterans in the state of Maryland. Right now we're right close to 80,000 veterans right in Prince George's County. And with us being on the commission, the biggest item from the audience is it's too far sometimes to go to Washington or to Baltimore. And maybe they might want to consider, because I know we have a lot, we work through the city council. I'm sure we could find some sort of a facility that we could put a CBOC in where it won't really cost that much, like starting from the ground zero. So this is something we might want to consider
Sure.
with this
Sure.
information.
Sure.
But that would be part of the Washington, D.C. VA center as opposed to Baltimore.
Well, I guess we'd have to look at that location, but yes, we are sort of on the line here, so that would probably have to be considered. Yeah.
Besides this televet program, is there something else going on as far as outreach is concerned with the VA?
Well, we continue to grow, and as we were speaking, one of the things that we try to do is not have people wait any more than 30 days for appointments. And so we have a lot of construction that's going on right now where we're trying to enhance our services. And at our Loch Raven campus, which is where we do our rehab, we are adding an addition that will be dedicated to specialty therapies. And we're also going to place on that campus a research building that will be dedicated to stroke victims. And they're going to research the impact of exercise and how that can help in the recovery process. Down at our Baltimore site, we are doing a lot of work. We are adding space inside our building. We're landlocked there, and we're next to the university. And one of the things that we're trying to do is add some additional space inside so we can expand our primary care, mental health, and our women's clinic. There's a whole new emphasis in VA trying to dedicate clinics and programs for women. And I'm sure, as you know, women are now more and more a part of the military. And so trying to take a look at our services and our clinics and make sure that we meet their needs, because there is some difference in some of the types of care and some of the way that women like to receive care. We're finding that women would like to have some of their own carved out space within our system. They don't always want to receive care in the same way and places that the male veterans do. So that's something else that we're expanding, and would like to get that message out that, you know, we are looking for our women veterans to choose us for their health care.
Are your numbers on, you gave a number that you deal with in the state, is this increasing over the last few years, or what's the ratio?
Well, for returning?
Yeah, just in veterans in general, the number you deal with. You gave it from the figure, I think it was 80-something thousand.
We have 54,000
54,000. Is that larger than it used to be, or is it smaller?
You know,
Or does it stay constant?
our numbers have been relatively constant. Something that, though, that we're always looking to do is increase our enrollment. We feel this is important.